Alright, so we were explaining the model of the heart and the blood flow. So we have the right atrium, the right ventricle, the left atrium, the left ventricle, the coronary sulcus, interventricular sulcus. You have the right coronary artery, which is also branched off with the marginal artery, and the posterior interventricular or descending artery. And then here's your interventricular sulcus, which here you can't see the left coronary artery, but off the left coronary artery is the circumflex artery, and the anterior descending or interventricular artery, also known as the widow's maker. And then you have the great cardiac vein, the small cardiac vein, and then the middle cardiac vein, which all drain to the coronary sinus, which goes to the right atrium. And then you have the ligamentum arteriosum, and the epicardium is what surrounds the heart. And then you have the base, or the apex, then the base, and off the base you have vessels like the pulmonary arteries, and then you have the aorta, which is the branches off of the brachiocephalic, the left common carotid, and the left subclavian, the superior vena cava, the inferior vena cava, and the pulmonary veins. And then you have the atrioventricular valves, which is the tricuspid and the bicuspid, also known as the mitral. And then you have the aortic semilunar valve, and then you have the pulmonary semilunar valve. And then you have the chordae tendineae on the end of these valves, the atrioventricular valves, and that ties on to the papillary muscles. And then lining the ventricles are the trabeculae carneae, and then you have the pectinate muscles, which you can't really see on this model. These are the fossa ovalis, and then you have the interventricular septum, which divides the two ventricles, and then you have the epicardium, the myocardium, the endocardium with simple squamous epithelium, and now the blood flow. So what happens is, pretend I'm a little red blood cell, go through the inferior vena cava, the superior vena cava, to the right atrium, through the tricuspid, to the right ventricle, and then through the pulmonary semilunar valve, through the pulmonary arteries, out to the lungs to become oxygenated, coming back through the pulmonary veins, and then into the left atrium, through the tricuspid or bicuspid or mitral valve, into the left ventricle, and then through the aortic semilunar valve, and then through the ascending aorta, aortic arch, descending aorta, and then out to the thoracic aorta, abdominal aorta, and down from there.
Action.
So this is the bronchial tree. This is the trachea, the carina, the primary, the secondary, and the tertiary.